Welcome to the 9th Annual Digital Health Summit at CES. I remember my first Digital Health Summit where we were just teaching people about what mobile health was, what telemedicine was. I think I might have even had a session called Telemedicine 101. It was over 9 years ago. And we were just talking about the future, but we weren't really living it yet. Now we have data, we have proof, we have studies, and so much more to share with you. The Digital Health Summit is not your regular healthcare conference. It's much more than that. It brings the consumer and it brings the patient front and center into the medical and wellness picture, but always, always stays focused on the healthcare field as a whole. Over the next 2 days, we will cover a wide variety of topics, all of which fall under the umbrella that we call digital health. We kick off today with the brain. How is technology being used to transform the worlds of mental health, Alzheimer's, traumatic brain injury, autism, addiction, and so much more? We then move into the personalized healthcare revolution, focused on what I like to call the hyper-personalization of healthcare. I'm excited to welcome Dr. Anand Iyer from WellDoc and Chris Van Hoof from IMEC to share their most exciting developments at our show. Shh, backstage, please. Thank you. We'll then have our very first Lunch and Learn session, where our guests will gain expert insights into how mixed reality and artificial intelligence will enable bots like Alexa and Google, which you all hear about, to serve all facets of healthcare in the home and in the hospitals and in the other healthcare settings. After lunch, apologies, I skipped forward there. Bring on the bots. After lunch, we'll move into consumer and patient-centered healthcare. This covers everything from how some of today's most powerful brands like Johnson & Johnson, Nokia, and Teladoc are delivering transformative solutions to consumers, to how powerful partnerships like Omron and AliveCor are striving to eliminate heart attacks and strokes. Today, moving into aging, caregiving, and monitoring, the developments utilizing predictive analytics and integrating sensors into state-of-the-art hospitals are quite profound, and I can't wait for you to hear about what's going on. And then, as we close out today, we've invited some of the most cutting-edge emerging technologies to the show, from VR for pain management to new speedy lab diagnostics and at-home genomic testing. You will not be disappointed in what you see. So, as you know, we could not do anything that we do up here without the support of you, our attendees, as well as our most supportive sponsors. I'd like to personally thank our prolific group of platinum sponsors, most of which, have brilliant booths down on the show floor. So if you have the opportunity to visit them, please do in the Digital Health Summit section downstairs in the expo. And a special thanks as well to our gold sponsors. Please make sure to visit their exhibits downstairs as well. I saw a lot of really cool stuff. I will be up here for 2 days. They've locked me away up here, but on Friday I will be canvassing the floor. So, I have heard about some amazing relationships that have been formed at this show. And I'm not even talking about those that have been speakers on the stage. I'm talking about who's in the room and who you might meet. Please, please, please take the time to introduce yourself to others around you. I'm from the school of you never know, and I promise you there is an astounding group of attendees this year. We are completely, when I saw the list, I was so blown away by the companies that are attending this year. So I really hope that you have the chance to mingle with each other during breaks, introduce yourself to who's around each other. I invite you to Facebook Live. I invite you to tweet. Digital Health CES is our hashtag. But more importantly, I hope you are in the moment to absorb it all.